As we age, it's not surprising that many of us may need some form of visual assistance to help us get through our day-to-day activities. But what you may not know is that over 50% of Americans will suffer from cataracts by the time they turn 80 years old, and a pair of glasses may not help. Dr. Ben Perez also treats patients suffering from glaucoma. It is estimated that over 2.2 million Americans have glaucoma, but only half of them know that they have it. His patient, Candace Lesher, was one of those who did not think her vision problems were caused by glaucoma.
I had stabbing pain above my right eyebrow that felt like a ice pick was, and I also had pressure on the inside of my eye there. I thought I had a sinus infection, and I told my primary care doctor, I told her I thought I had a sinus infection, and she sent me for a CAT scan. She said, you need to see an ophthalmologist. So I went to see Dr. Perez, and he told me I had narrow angle glaucoma and cataracts.
The cataracts can develop from congenital cataracts that you're born with, which are quite rare, to juvenile cataracts from diabetes. But most of the cataracts that we see are age-dependent. A degeneration of the eye, the crystalline lens of the eye, it loses its transparency. And so, sure enough, a small scratch on your windshield will be enough to limit your vision. In the same way, a small cataract can limit your vision, the glare, the starburst that we see. These progress to become larger to the point that they limit overall reading ability.
I didn't realize my quality of life was deteriorating. I thought everything was okay, except that I had the pain above my eye. I mean, I was so used to wearing glasses and seeing through glasses. I mean, you know, when you wear glasses all the time, you have it's like you're looking through a fog. And, but you don't realize that you're looking through a fog. You think you're seeing everything. Well, since the surgery, I now know that I am seeing everything now.
The early warnings for cataract and the symptoms of cataract are subtle, and they're very gradual and certainly progressive. But the first ones that we usually see is when folks have changed glasses more than one time, and here they come to our office for a good pair of glasses, if you will. These 3 glasses that I've had in the last 3 years don't seem to do the job. I'm having trouble driving my car at night. There's starburst, there's glare, and it's no longer a refractive issue as far as glasses. It's something more internal. It's your lens that's not clear. And until that lens is addressed, no glass outside the eye will help.
Went to Memorial Hospital. They gave me outstanding care. I was in, I was out, very efficient, so quick that I almost didn't realize it happened. And I was looking forward to going back for my right eye surgery.
The cataract surgery, again, it's the #1 surgery performed in the country. It's a very simple surgery, if you will. It takes between 10 to 15 minutes to perform the procedure from start to finish. In essence, what we're doing is we're removing the clouded lens inside your eye and replacing it with an artificial implant, usually an acrylic intraocular implant. And the procedure, again, it's painless, and there's no stitches involved. By and large, most of us are able to aspirate the lens through a small incision, 2 millimeters, that is self-sealing. And the results are remarkable. Within a day's time or 2, you're just about back in the saddle, depending, of course, on your job description. But the restoration of vision is often seen within days. Well, Memorial has advantages that none of the other hospitals here in the city have. It's an attractive hospital because, A, it's a neighborhood hospital. It's so convenient. It's right down the street. What I love about Memorial is that the people that make up that institution. Because of its size, I think we have more of a direct one-on-one care. The hospitality that you receive from the moment you walk in through the doors with the volunteer ladies, all the way through the cafeteria, up into the operating room, it's an experience. And one of the things I always love about Memorial is that so often we know we've done the right job. When before the eye is finished, before the patient leaves the operating room, he's already asking or she's already asking, Doc, when can we do the other eye? And that's a testimony to the service that they've received, to the hospital itself. They don't know what I've done. They have no idea what they're going to see tomorrow. But yet the experience has been one that Memorial has set forward to make people want to come back a second time. It's amazing. Don't let the size fool you. We have the technology there that every other hospital here, major hospitals has. We have the machinery to remove cataract surgery, the phaco emulsificator. We have the microscopes. We have state-of-the-art equipment in those operating rooms. To the point, again, that's where I take my family.
After the surgery was over, I went to, we came home and I had a gardenia bush in my front yard, and I went to go smell the flower, and when I did, I seen the little thrips on the flower that I would have never seen, even with my glasses on. Since I had my surgery, I'm looking forward to better driving experiences and my average coming up on my bowling, and maybe picking up the big 4.
And so when someone comes to us, and we see little miracles just about every week, someone that we really didn't expect to regain vision, and yet we take them there, and with the help of above, we're able to restore eyesight and make someone that was blind see. It's such an uplifting feeling. Oftentimes we have the same patients talk to others outside and encourage them, please do not live in blindness, do not live in the dark, seek attention, seek help. We have experts here in Tampa, Florida, we have experts hospital, and so often some of the diseases that years back were kind of thrown by the wayside, that people lost hope in, nowadays with technology we have, we're able to restore vision in ways that we couldn't before.
Did you know glaucoma is the second leading cause of blindness in the world and is 6 to 8 times more common in African Americans than Caucasians?
Between the doctor and Memorial and the type of care I received, coming to the Rays game, I'm able to see the scoreboard again, I can see the ball.
Janet is seeing the difference because of Memorial Hospital's surgical excellence in ophthalmology and more best doctors on the west coast of Florida.
What I find particularly wonderful about Memorial Hospital is it's a small community hospital, but the emphasis is on customer service and patient care.
Memorial Hospital of Tampa. See the difference. Log on to ionmemorial.com.